Welcome to News West 9's West Texas View with Johnny Lou Avery.
I'm so happy to welcome back Dr. Bobby Jain, who was here last Sunday. Dr. Jain is the department chair of the Department of Psychiatry for the Texas Tech University Health Science Center. He's also a practicing physician as a psychiatrist, and we ended our program with him telling a little bit about what Texas Tech was about, what the Texas Tech Clinic of Physicians is about, and so we need to revisit that because we didn't finish it. But also, he had mentioned at the beginning that Texas University Health Science Center is a network of training facilities, of teaching facilities, not only for doctors and nurses and all kinds of allied health like physicians and pharmacists and physical therapists and so on. But each of these doctors that are in the teaching positions also are practicing physicians. Am I saying that right,
yes,
Dr. Jain?
Right.
And so now continue about how you fit in. And I want you to tell a little bit about why there aren't as many psychiatrists as we need, because we've got a lot more people needing mental health, because all of a sudden mental health doesn't have a stigma like it used to, and people are getting the help they need for these very serious problems.
Yes and no, if I may. Yes, things are becoming much better in terms of people becoming more aware of the psychiatric needs and mental health needs. The stigma seems to be evaporating much faster than we are able to provide them services.
But it's still there.
It's still there. It's still there. And the stigma is not only there towards in the general public, the stigma is also there in young professional minds. For example, it's very difficult for me as a trainee, as a professional who is trying to train medical students, to encourage them to go into psychiatry. In 4 years of my tenure over here, I have been very unlucky in the sense to be able to get any medical student be interested in pursuing psychiatry.
Because some of these others are more glamorous, to be a pediatrician or a OBGYN or an internal medicine or something. Yeah.
It's a different, it's a quiet taste, and most people who go into psychiatry tend to have either very close brush with psychiatric illness themselves, or they have family members who have struggled with psychiatric illness.
They didn't understand it, so they don't want to be anywhere close to it.
And people who have no experience, or no had such, fortunately, didn't have any such experience with the family member themselves, tend to be a little bit scared, so as to speak, about dealing with psychiatric patients.
What you don't know, you are afraid of.
It's afraid of. But on the bright side, this year particularly, I have a number of medical students who have at least a step forward, put psychiatry into a number of possible fields they might be interested in doing that. To me, that's a step plus. It's a plus, a real plus. Why we're not able to train psychiatrists as many? Again, the same thing. Why we don't have psychiatrists? Because again, we're not able to interest so many of them.
Well, now tell us the difference between psychiatrists and a psychologist.
In the state of Texas, psychiatrists are MD doctors. They go to medical school, they go to residency training, and they are licensed to dispense medications and write prescriptions. The modern term psychiatry is moving away from providing comprehensive counseling and emphasize more towards medication management. And as money talks always, the onus of doing counseling and what we call psychotherapeutic talk therapy is becoming more and more purview of PhD psychologists, as we call it. Now they go to graduate schools. They don't go to medical school. They go to graduate school, and they get special training in helping patients through talk therapy. There are different types of techniques in talk therapy, and they go through different kinds of psychotherapy techniques in order to help people. So typically, in order to have a best and most rapid response to any psychiatric illness, be it depression, be it anxiety, or any of the forms of psychiatric illness, the combination of medications and psychotherapy, or talk therapy as we call it, tends to work the best. not only it gets early treatment, but also it prevents from getting relapses from treatment.
Well, do you normally work together
We
and
work together.
refer patients back and forth?
Right, right. So it's impossible for me. For example, I do have the luxury of having to see a patient of a 30-minute slot. In real life, outpatient psychiatry, you about get 15% face time with the psychiatrist. It's very difficult to do any form of talk therapy. So when we have only 10-15 minutes to talk to see a patient. But because I'm in academia, I don't have to generate revenue as much as a private practitioner will generate. And plus I do have the responsibility to teach and educate medical students and residents. I tend to get more time interacting with patients, doing some talk therapy. But in real life, when I say real life, I mean in commercial psychiatry practice, it is very difficult for a psychiatrist to do counseling also.
Well, and it's almost a waste of their training, because they're trained to really look at the chemical imbalances and things like that of a person, and a psychologist is trained to take it from there.
Right.
Almost.
Well, actually, in psychiatry also, we are trained. Our emphasis is mostly medication and the medical model of treating psychiatric illness, but we do get about 30% of our time trained in psychotherapy techniques. The movement towards, and this may be because of, again, financial issues, how the insurance get reimbursed, it's more and more moving away from the psychotherapeutic, that means talk therapy model, and more towards medication model. So if most psychiatrists will think that if I'm not going to get paid what our services are provided, then why should I do it? And that is causing them to move towards just medication, not doing counseling. That does not mean that counseling is not effective, but counseling can be equally, if not more effective than medications. And I'm a strong believer, and there's a lot of research and evidence to support that. For many psychiatric illnesses, counseling, though slow, but it's more long-lasting and probably more effective in dealing with psychiatric illness than medications.
Well, see, my view was that you got their chemical balance back to order and did all of the basic things, and then referred them back to a psychologist for the talk therapy. We're going to have to take a break now, but we'll be back in just a minute and continue this conversation with Dr. Jain, that always just has so many good things to tell us. We'll be right back.
Stay tuned. West Texas View will be right back.